I am a big proponent of doing, measuring cardiometabolic biomarkers, doing advanced lipid testing, if you're going to follow these kinds of diets, and knowing, for example, what your ApoB is, maybe your ApoE4, if you're a carrier or not, you probably want to trend to a little bit lower, less saturated fat. But the jury's kind of still out on that in some ways. But at the very least, you want to do advanced lipid testing, know your ApoB, your LDL, HDL, and your triglycerides, probably more importantly. And those things also in the context are blood markers, but also if those things are out of whack and you have high blood pressure, that's a big problem. But if you have low blood pressure and you're in good, physical fitness, cardiometabolic health, probably less of a concern if you have elevated ApoB and LDL, because it is probably going to happen if you go on a ketogenic diet, more so in males than in females. They tend to trend, for higher LDL particle count and ApoB in males. So, but the saturated fat will kind of dictate that to some extent, but not in everybody.
And how do you think about the different types of saturated fatty acids? So oftentimes in the literature or in just, if you talk to your physician or just in the general zeitgeist, we talk about saturated fat as if it's one thing. It's saturated fat, but there's obviously many different types of saturated fatty acids. So what can you start to tell us there? Like if someone thinks about, say, if you think about something like coconut oil or MCT oil versus butter, they're all high in saturated fat, but they've got very different types of saturated fatty acids. How consequential are those differences in the chain length and the individual saturated fatty acids?
Yeah, so medium chain triglycerides sold commercially as MCT oil are caprylic acid and capric acid, or octanoic acid and decanoic acid, so C8 or C10. So these are saturated fats, and these are a big part of our research and a big part of the formulation of our research ketogenic diets and a big part of the ketogenic diet that I eat. So these medium chain fatty acids, when they are consumed, they go to the liver via hepatic portal circulation, and they're not packaged into chylomicrons like long chain fats.
So basically that means they go to the liver directly as opposed to getting packaged in the packaging that will go through your bloodstream that you would measure in like a lipid blood test.
Yep. The chylomicron. So they're essentially like a bolus of fat going into the liver, and when you ingest high amounts of these and you take out an animal's liver, it's actually full of fat. It looks like they have a fatty liver, but there's no major evidence of necrosis or no major evidence of inflammation unless you go really high MCT, and then it starts to cause like some structural things, and then you get sinusoidal dilation. It's like sort of widening of the gaps in the cells in the liver. But that's under extreme situations, so that'd be like us pounding like 300 to 500 milliliters of MCT per day. So you get some abnormalities. But the important thing is that these MCTs go right to the liver, and they stimulate fatty acid oxidation in the liver called beta oxidation. And
so that's basically the burning of fatty acids for ATP production as opposed to storage in the body and adipose tissue.
That's right. And they're almost like training the mitochondria in the liver to really ramp up.